Every single day, nearly 2,000 seniors are rushed to the ER because of a medication they trusted, and over 100 die, not from disease, but from the drugs meant to help them. Source: CDC and National Institutes of Health. It's one of the quietest killers in senior health. Not cancer, not heart attacks, not strokes. Medications, common ones, over-the-counter ones, doctor-approved, insurance-covered, even AARP recommended. And they're not being abused, they're being taken exactly as directed. The familiar story you've heard, or lived. Joan is 73. She doesn't drink, doesn't smoke, and walks every morning. But over the past year, she's felt weaker, dizzier. She stumbled getting out of bed. She forgot her son's birthday. Her doctor ordered scans, blood tests, even brain imaging. Nothing turned up, until her daughter asked, "Mom, could it be your meds?"
Turns out she was on 6 medications with known side effects for seniors over 65, including an antihistamine linked to memory loss, a blood pressure pill that lowers balance, a sleep aid that quadruples fall risk. No one had flagged it. No one had warned her, because no one had time. You're not just getting older. You're getting over-medicated. By age 65, nearly half of all seniors take 5 or more prescription drugs daily, CDC 2024. That number jumps to 12+ medications if you're in long-term care. But here's the problem. Most medications are tested on younger bodies. Doses are rarely adjusted for senior metabolism. And the risks? Buried in fine print. Your liver clears slower. Your kidneys filter less. Your brain reacts more intensely to chemicals. But the pills just keep coming. And you think it's just aging. You forget names more often. You feel unsteady in the grocery store. You're sleeping more, thinking less. And you assume this is just what getting old feels like.
But what if it's not? What if that tiny pink pill you take every night before bed is dulling your mind, shrinking your memory, weakening your body? This is not anti-medicine. This is pro-wisdom. Some medications save lives, but others may be slowly draining yours. And no one tells you, because even your doctor is often too rushed, too tied to outdated guidelines, or simply unaware of new research on aging. This video is your wake-up call. We're walking through 7 medications that are commonly taken by adults over 65, but that may be weakening your muscles, damaging your gut, fogging your brain, and quietly increasing your risk of hospitalization, or worse. Each one backed by science, each one with safer options, each one you deserve to know about. We spend over 30 hours building each video, not for clicks, not for sponsors, but because your health, or your loved ones, depends on knowledge your doctor didn't have time to explain.
So, if this helps you breathe easier, think clearer, or walk steadier, don't just watch, subscribe. Be the reason we're still here next week. NSAIDs, the silent, gut-damaging painkillers most seniors trust. It starts with a little ache, a stiff joint, a sore back. And so you reach for the bottle. You take a pill. Relief comes. But what you don't feel is the erosion slowly happening inside you. What are NSAIDs? NSAIDs, non-steroidal anti-inflammatory drugs, are everywhere. Ibuprofen, Advil, Motrin, naproxen, Aleve, aspirin, prescription-strength NSAIDs like meloxicam, diclofenac. They're used for arthritis, headaches,
joint pain, back pain, even menstrual cramps. They work by reducing inflammation, blocking enzymes, COX-1 and COX-2, that produce prostaglandins, the chemicals that trigger pain, fever, and swelling. Sounds good, right? Until you realize. The GI tract time bomb. Prostaglandins aren't just for pain. They also protect your stomach lining. So when NSAIDs block them, your gut becomes vulnerable to acid, ulcers, and internal bleeding. Stat. Each year, over 100,000 Americans are hospitalized from NSAID-related GI complications. American Gastroenterological Association. And guess who's most at risk? Seniors. People taking NSAIDs daily. Anyone using NSAIDs alongside blood thinners, steroids, or SSRIs. People over 65 with kidney or heart concerns. You might not feel it until it's too late. That's the scariest part. There are often no warning signs until you start passing black stools, feel dizzy from blood loss, end up in the ER with a GI bleed, or in severe cases, don't survive it. Even low-dose aspirin, commonly used for heart health, can increase GI bleeding risk with age. One study in BMJ found that adults over 70 had a 10-fold higher risk of major bleeding events when taking daily aspirin, especially with no protective medication alongside it. And it's not just your gut. NSAIDs have also been linked to increased blood pressure, kidney damage, especially in dehydrated seniors, higher risk of heart failure with chronic use. In 2015, the FDA issued a strong warning that NSAIDs can increase the risk of heart attacks and strokes, even after short-term use. For seniors already managing blood pressure or heart conditions, this risk stacks dangerously. But my doctor told me to take it. Here's the truth. Many doctors still routinely recommend NSAIDs because they're cheap, effective, and familiar. But not all providers keep up with age-specific risks, and they may not be fully aware of the compounded dangers for seniors on multiple medications. It's not about blaming your doctor. It's about asking better questions, safer alternatives, backed by research. If you're reaching for NSAIDs often, you're not out of options. Acetaminophen, Tylenol, safer for short-term pain relief in seniors, does not harm the stomach. Safer, but avoid exceeding 3,000 milligrams per day. Check labels. Many combo drugs contain it. 2. Turmeric with black pepper extract. A 2020 study in Trials Journal found that curcumin was as effective as ibuprofen in treating knee osteoarthritis without GI side effects. Standard dose: 500 to 1,000 milligrams per day, taken with food. 3. Boswellia serrata. Anti-inflammatory herb used in Ayurvedic medicine, shown in clinical studies to reduce joint pain and swelling. Typical dose: 300 to 400 milligrams, 2-3x daily. 4. Topical NSAIDs, example diclofenac gel. Offers localized pain relief with less systemic absorption, better for knees, hands, and back pain. 5. Physical therapy and strength training. May take time, but has long-term pain-reducing effects without pills. Portion and safety tips for NSAIDs. Never exceed 1,200 milligrams per day of ibuprofen without doctor supervision. Avoid daily use longer than 3 days unless prescribed. Always take NSAIDs with food. Ask your doctor if a proton pump inhibitor, PPI, is needed for gut protection. Avoid NSAIDs altogether if you are over 70, have a history of ulcers or GI bleeds, take blood thinners, have kidney or heart conditions. You're not weak for taking pain meds. You're not reckless. You are doing what millions do, trying to get through the day. But now you know the risks, and knowledge makes you powerful.
Don't let a pill designed to bring you comfort be the one that robs you of your independence. You deserve pain relief without fear, and with the right tools, that's possible. Proton pump inhibitors, PPIs, bone loss and nutrient depletion hidden in your heartburn meds. You took it for the burning in your chest, but it might be hollowing out your bones. What are PPIs? Proton pump inhibitors, or PPIs, are medications that reduce the amount of acid your stomach produces. They're used for acid reflux, GERD, heartburn, stomach ulcers, Barrett's esophagus. Common PPIs include omeprazole, Prilosec, esomeprazole, Nexium, lansoprazole, Prevacid, pantoprazole, Protonix.
They're incredibly effective. For many people, they're lifesavers, especially for preventing ulcers from NSAIDs or healing severe reflux. But here's the catch. PPIs were never meant to be used forever. Yet that's exactly how they're used, especially in adults over 65, the hidden bone loss risk. Your stomach acid isn't just there to cause heartburn. It helps your body absorb key nutrients like calcium, magnesium, and vitamin B12. When acid is suppressed for too long, those nutrients get flushed out instead of absorbed. Long-term PPI use is associated with a 35–60% increased risk of bone fractures in adults over 65. Source: Journal of the American Geriatric Society, 2017. In fact, the FDA issued a warning in 2010 linking high-dose or long-term PPI use to fractures of the hip, wrist, and spine, especially in seniors. But that's not all: brain, muscles, and more. PPIs have also been associated with low magnesium, muscle cramps, irregular heartbeat, seizures, B12 deficiency, brain fog, memory loss, nerve pain, increased infection risk, especially C. diff, a dangerous gut infection that can be fatal in seniors. A study in JAMA Neurology even found that seniors on long-term PPIs had a 44% higher risk of developing dementia, though more research is ongoing. But it helped me so much. Yes, and short-term it probably did. But here's what doctors often don't have time to explain. PPIs are powerful. Too powerful for daily, long-term use without reevaluation. They were originally approved for 4 to 8 weeks of use, not years. But in the U.S., over 15 million people take them every day. Many for years, and many are over 65. Safer alternatives and smarter use. If you're dealing with heartburn or GERD, don't stop cold turkey. But here's what you can try. 1. Step down gradually. Talk to your doctor about tapering your PPI dose. Abruptly stopping can cause rebound acid production. 2. Switch to H2 blockers.
Ranitidine, recently recalled, famotidine, Pepcid, may be milder and safer short-term. 3. Elevate the head of your bed. Reduces nighttime reflux without meds. 4. Avoid trigger foods. Common culprits include spicy food, chocolate, coffee, alcohol, tomato-based sauces. 5. Eat smaller meals. Don't lie down after eating. 6. Try DGL licorice or aloe vera juice. Some natural options help soothe the stomach lining. A study in phytomedicine found that DGL, deglycyrrhizinated licorice, may be as effective as antacids in reducing acid symptoms, without suppressing stomach acid. Portion and duration. Tips for seniors. Use PPIs at the lowest dose for the shortest duration possible. Don't exceed 8 weeks of daily use unless medically necessary. Ask your doctor if you can take it on demand instead of daily. Pair long-term PPI use with calcium citrate, B12 supplements, and bone scans. You deserve relief, not depletion. You don't have to live with burning pain.
But you also don't have to trade comfort for broken bones and brain fog. Your stomach acid isn't your enemy. It's part of your digestion, your immunity, and your strength. You deserve relief that supports you, not relief that slowly strips your body from the inside out. Anticholinergic medications, the dementia link no one warned you about. You thought you were just forgetting names,
But it might have been your pills, not your age. What are anticholinergic medications? Anticholinergic drugs are a class of medications that block acetylcholine, a key neurotransmitter responsible for memory, learning, attention, muscle function, digestion. They're used for a wide range of conditions, including allergies, diphenhydramine, Benadryl, depression, amitriptyline, overactive bladder, oxybutynin, tolterodine, Parkinson's symptoms, benztropine, sleep aids and cold medications, Tylenol PM, the brain-damaging risk of blocking acetylcholine. Here's the problem.
As we age, our brains naturally produce less acetylcholine. So, when we take medications that further suppress it, the effects are amplified, especially in seniors. Stat: older adults taking strong anticholinergic medications for 3+ years have a 54% increased risk of developing dementia. Source: JAMA Internal Medicine 2015. These aren't just scary numbers. They reflect real-life cognitive damage linked to the symptoms you might already be feeling. Memory lapses, word-finding problems, trouble focusing, confusion or feeling disoriented, slower reaction time, urinary retention or dry mouth, vision changes. And here's the kicker. Most seniors don't associate these symptoms with their medications. They assume it's just aging, when it may be chemical interference from an everyday pill. The anticholinergic burden, how it sneaks up on you. Even if a single medication seems mild, multiple medications with anticholinergic effects can stack up and overwhelm your nervous system.
This cumulative effect is called your anticholinergic burden. A 2021 study in Age and Aging found that even low-level exposure, over time, is linked to increased brain shrinkage and cognitive decline. Medications that contribute to the anticholinergic burden include over-the-counter sleep aids like Tylenol PM, ZQuil, bladder control meds like oxybutynin, ditropan, older antidepressants like amitriptyline, nortriptyline, certain antipsychotics like quetiapine. Why most doctors don't catch this? Even good doctors can overlook this. Why? These meds are commonplace. Side effects are subtle and build slowly. There's no simple test for cognitive risk from medication. Guidelines on deprescribing are often unclear. Plus, many of these drugs are marketed with no warning about long-term effects in older adults. Safer alternatives and smart substitutions. If you're taking any anticholinergic drugs, don't panic, but do review them. Here's what research and geriatric specialists recommend.
1. Allergy relief. Benadryl, loratadine, Claritin, cetirizine, Zyrtec. Lower brain penetration, less anticholinergic activity. 2. Sleep support. Tylenol PM, magnesium glycinate, melatonin 0.5 to 1 milligrams, cognitive behavioral therapy for insomnia. CBTI has been shown to be more effective than meds for chronic insomnia in seniors. 3. Bladder control. Oxybutynin, mirabegron, Myrbetriq. Newer med that works differently, doesn't block acetylcholine. 4. Depression. Amitriptyline, sertraline, Zoloft, escitalopram, Lexapro. Newer antidepressants with lower cognitive side effects. 5. Dizziness, nausea, motion sickness. Meclizine, ginger capsules, with clinical evidence, physical therapy for balance. Portion and tapering tips. Never stop anticholinergic medications abruptly. Taper under supervision. Keep a printed medication list and ask your doctor or pharmacist to evaluate anticholinergic load.
Use online tools like the ACB calculator, anticholinergic cognitive burden, to estimate risk. Ask your doctor, is there a safer version of this for my age? You're not forgetting, you're awakening. You're not just getting old. You're getting smarter about what's going in your body.
You deserve mental clarity, not confusion. You deserve sleep, not sedation. You deserve to age with your mind intact. Benzodiazepines, how anti-anxiety pills can quietly destroy balance, sleep, and independence. It helped you sleep. It calmed your nerves. But now, you can't walk straight, you can't remember things, and you don't know why. What are benzodiazepines? Benzodiazepines, or benzos, are a class of sedative medications that calm the nervous system by enhancing the effect of GABA, a brain chemical that slows things down. They're prescribed for anxiety, panic attacks, insomnia, seizures, muscle spasms. Common benzodiazepines include diazepam, Valium, alprazolam, Xanax, lorazepam, Ativan, clonazepam, Klonopin, temazepam, Restoril. Why benzos are so dangerous after 65? Benzos work, and they work fast. But in seniors, their side effects hit harder and last longer due to slower liver metabolism. Stat: older adults who take benzodiazepines are 2.5 times more likely to suffer a serious fall, fracture, or head injury. Source: American Geriatric Society, 2022. The risks include severe drowsiness, confusion and memory loss, poor coordination and balance, daytime sedation, even if taken at night, increased risk of dementia. The vicious cycle. Benzos may help you sleep for a while, but over time your brain becomes dependent on them. And then, you can't sleep without them. You feel more anxious between doses. Your memory starts to fade. You may begin to feel off, but can't explain why. A 2018 study published in BMJ found that long-term benzo use was associated with cognitive decline, even when taken in low doses. Not meant for long-term use. Despite their wide use, benzodiazepines were never designed for long-term daily use, especially not in older adults. The Beers criteria, which outlines medications that are potentially inappropriate for seniors, strongly recommends avoiding benzos after age 65 due to the high risk of cognitive impairment, delirium, falls, and fractures. Yet studies show that 10 to 15% of adults over 65 in the U.S. still take them regularly.
The hidden addiction no one talks about. Benzos are physically and psychologically addictive. Stopping them suddenly can cause rebound anxiety, insomnia, tremors, sweating, heart palpitations, seizures in severe cases. This makes tapering off extremely difficult, especially without medical supervision. One study in the Journal of Clinical Psychiatry found that over half of seniors on benzos had been taking them for more than a year, despite guidelines limiting use to 2 to 4 weeks. Safer alternatives to benzos for seniors. If you're struggling with anxiety or sleep, you're not alone, and there are safer options. For anxiety, cognitive behavioral therapy, CBT, proven effective for anxiety in older adults. SSRI antidepressants like escitalopram, Lexapro, not habit-forming. Buspirone, anti-anxiety med without sedative effects. L-theanine, naturally calming amino acid found in green tea. Breathing exercises, meditation apps tailored for seniors. For insomnia, CBTI, cognitive behavioral therapy for insomnia. More effective than sleeping pills over time. Melatonin, 0.5 to 1 milligram, helps reset sleep-wake cycle. Magnesium glycinate, supports sleep without sedation. Sleep hygiene, cool, dark room, consistent bedtime, no screens before bed. Tapering tips. Never cold turkey. Work with your doctor on a slow taper, sometimes over several months. Ask about cross-tapering with safer medications. Consider therapy during withdrawal for emotional support. Track your symptoms in a notebook or app. Important: stopping benzos suddenly can be dangerous. Always taper with supervision. You deserve calm without losing control. This is not your fault. You were told this would help you, and maybe it did at first. But now you know more, and you deserve a life that's calm, clear, and grounded, without pills that steal your balance, your memory, or your freedom. Freedom isn't just about walking unassisted. It's about waking up feeling like you again. Statins, the most prescribed drug in the U.S., and the muscle and memory side effects seniors should know about. They told you it would save your heart, but no one warned you it might break down your muscles or cloud your mind. What are statins? Statins are cholesterol-lowering drugs used to reduce the risk of heart disease, heart attacks, and strokes. They work by blocking a liver enzyme, HMG-CoA reductase, involved in producing cholesterol. Common statins include atorvastatin, Lipitor, simvastatin, Zocor, rosuvastatin, Crestor, pravastatin, Pravachol, lovastatin, Mevacor. They're among the most widely prescribed medications in the world. In the U.S. alone, over 92 million adults use statins, and nearly half of all adults over 65 are on one. But here's the truth no one says loudly enough. Statins aren't harmless, and for some seniors, they may cause more problems than they prevent. The muscle breakdown risk. Statins work in the liver, but one of the most common side effects happens in your muscles. Symptoms include muscle pain, weakness, cramping, fatigue, difficulty climbing stairs or walking long distances. Up to 25% of statin users experience some form of muscle pain or weakness, and the risk increases with age. Source: Cleveland Clinic, 2022. Why does this happen? Statins reduce coenzyme Q10, CoQ10 levels, a nutrient your muscles need to produce energy. When your muscles don't get enough, they fatigue faster and may begin to break down. In rare but serious cases, statins can trigger rhabdomyolysis, a condition where muscle tissue breaks down so severely that it damages the kidneys. Brain fog and memory issues. Statins also cross the blood-brain barrier, and while many tolerate them well, some seniors report memory lapses, confusion, difficulty finding words, brain fog, or delayed thinking. The FDA has issued public warnings about these cognitive side effects, especially in older adults, noting that symptoms typically reverse after stopping the medication. A 2015 analysis in pharmacotherapy found that some statin users experience significant memory improvement after discontinuation. Overprescribed? The debate around statins in seniors. Here's the core issue. Not everyone benefits equally. In older seniors without heart disease, the evidence is mixed on whether statins actually reduce mortality. Yet they're often prescribed automatically based on cholesterol numbers, without individualized evaluation. A study in JAMA Internal Medicine found that many adults over 75 were prescribed statins for primary prevention, even though the benefits for this age group were unclear. When statins might still be worth it. Statins can absolutely save lives when you've had a heart attack or stroke, you have a diagnosis of coronary artery disease. Your doctor has evaluated your overall cardiovascular risk. But if you're over 65 and have no history of heart disease, and you're feeling weak, foggy, or in pain, it's time to ask, is this helping me or hurting me? Safer strategies to discuss with your doctor. 1. Switch statins or lower the dose. Some statins are less likely to cause side effects, including pravastatin and rosuvastatin. Sometimes a lower dose is enough to provide benefits with fewer problems. 2. Consider intermittent dosing. Some doctors now prescribe statins 2 to 3 times a week for seniors who are sensitive to daily doses, especially when combined with lifestyle changes. 3. Add CoQ10. Supplementing with 100 to 200 milligrams of CoQ10 daily may reduce statin-related muscle side effects. Some cardiologists recommend this automatically for older patients. 4. Focus on diet and movement.
A Mediterranean-style diet, rich in olive oil, nuts, leafy greens, and fish, can significantly improve cholesterol levels, even without meds. 5. Reassess the need. Periodically, if you've been on statins for over 10 years, ask your doctor if you still need them, especially if your overall heart risk is now low. Portion and monitoring tips. Always take statins at night unless your doctor instructs otherwise. Get regular liver function and creatine kinase (CK) tests to monitor for side effects. Report any new muscle pain or memory issues immediately. If starting statins after 65, request a 3-month follow-up evaluation before continuing long-term. You deserve a strong heart and a strong body to go with it. You're not wrong for taking a statin. You're not weak for wanting to avoid heart disease. You're not imagining the pain in your legs or the fog in your mind. You're wise for asking questions. You're brave for choosing clarity.
And you're right to expect a solution that protects your whole body, not just your numbers. Section 7. Polypharmacy, the hidden epidemic of too many pills, and how it's silently killing seniors every day. You don't take anything dangerous, just what the doctor prescribed, but somehow your pills are making you sicker. What is polypharmacy? Polypharmacy is when someone takes 5 or more medications daily, often prescribed by different doctors, for different conditions, without coordination. Stat. Over 40% of adults over 65 take 5 or more prescription drugs. Source, CDC, 2024. Even worse, 1 in 5 take 10 or more. Many are also taking supplements, over-the-counter meds, and herbal remedies, which can all interact. Why this is so dangerous? Every drug you take has a risk-benefit profile, but when medications combine, they don't just add up. They can interact, amplify, or cancel each other out. Some combinations can raise blood pressure, lower your heart rate, sedate you excessively,
Damage your liver or kidneys, raise fall risk, trigger confusion, hallucinations, or memory loss. Polypharmacy is now one of the top causes of hospitalizations in seniors, even more than falls in some age groups. American Geriatric Society 2022. Why it happens, even with good doctors. Polypharmacy rarely starts as a mistake. It happens gradually. A blood pressure pill for high BP, then another to control the side effects of the first, then an antacid because the second upsets your stomach, then a sleep aid because you're uncomfortable at night, then a laxative because the sleep aid slows digestion, then a statin, then a supplement for your joints, and suddenly you're on 8 pills, and no one has looked at the full picture. The body after 65 can't handle the load. At 25, your liver can detox efficiently. At 65, it's slower. Your kidneys filter less. Your brain reacts more intensely to sedatives, stimulants, and anticholinergics.
Taking multiple medications in an aging body increases the risk of falls, fractures, dizziness, hospitalization, early nursing home placement, death. And the scariest part? Many seniors don't realize the symptoms they're having are coming from the medications themselves. The more you take, the more you need. Polypharmacy becomes a self-feeding cycle. More pills, more side effects, more side effects, more prescriptions, more prescriptions, more confusion, weaker balance, worse sleep, more fear. You become chemically dependent, not addicted, but tangled. And no one blames you. You were doing what every senior does, trusting the system. How to fight back, without giving up your safety. You don't need to go natural or abandon medicine. You need a smarter, simplified medication plan. 1. Do a medication audit. Ask your doctor or pharmacist to review your complete list, prescription, OTC, supplements, vitamins, and flag duplicates, interactions, or outdated meds.
2. Request a deprescribing plan. Yes, deprescribing is a real medical strategy. Some medications can be tapered, reduced, or stopped under supervision. 3. Use one pharmacy. When you fill prescriptions at multiple pharmacies, no one sees the whole picture. Stick to one. 4. Ask, do I still need this? Every 6 to 12 months, especially after surgeries, acute illnesses, or hospitalizations where many drugs are added temporarily. 5. Get a geriatrician or clinical pharmacist involved. They're trained to manage polypharmacy in older adults and can help coordinate your care safely. Senior-specific pill safety tips. Use color-coded pill boxes with alarms or apps. Avoid as-needed meds unless clearly tracked. Keep an updated medication list in your wallet or phone. Be cautious with herbal remedies. Many interact with blood thinners, sedatives, and heart meds. Less isn't reckless, it's wise. You don't need more chemicals to stay alive.
You need the right ones, at the right time, for the right reasons. You deserve a body that feels stable, a brain that feels clear, and a routine that feels human again. The system may push prescriptions, but you push back, with wisdom, questions, and confidence. You're not powerless, you're evolving. You were told to take the pill, so you did. You weren't reckless, you weren't naive. You were trying to feel better, to get through the day, to do what was right. And now, you're here. You're not just surviving anymore. You're asking questions. You're looking at that prescription bottle and thinking, is this still helping me, or is it holding me back? That is not weakness. That's wisdom. That's ownership. You deserve to age with clarity, strength, and choice. You don't need to memorize medical journals. You don't need to fight your doctor. You just need to do what you're doing right now. Pay attention. Ask the uncomfortable questions. And remember that you are the gatekeeper of your own body. Aging doesn't mean surrendering your independence. It means protecting it with smarter choices, better habits, and compassionate care. Daily habit reinforcement. Here's what you can do today and every day forward to protect your health. Keep a written or digital list of every medication and supplement you take. Review that list every 3 to 6 months with one trusted healthcare provider. Ask one simple question about each item. Do I still need this? Watch for subtle signs, fog, fatigue, weakness, imbalance, and speak up. Know that it's okay to revisit, revise, or rethink any plan, even ones that helped you in the past. Because the smartest thing you can do for your future health is question the things you've been doing automatically. If this video helped you feel more in control, please don't scroll past. We spend over 30 hours researching, fact-checking, and writing each of these scripts because we believe seniors deserve better than rushed visits and one-size-fits-all care. But we can't keep doing it without your help. If this made you feel stronger, if you learned something your doctor never told you,
if you feel less alone now than you did 10 minutes ago. Subscribe, share this with someone you love, and leave a comment below telling us what's one medication you're going to reevaluate this week. Because millions of seniors are quietly suffering from medications they were told to trust. And your story, your insight, could be the thing that helps someone else wake up too.